Thousands of people in Jacksonville could lose health insurance benefits if proposed city council budget cuts are approved.
That's right. We told you last week when the city's finance committee agreed on a new millage rate. And tonight, the city's chief health officer is sounding the alarm about what could happen to programs like HealthLink Jax.
Our Channing Curtis is joining us now. And Channing, programs like this have already helped a lot of people.
That's right. So the city's chief health officer, Dr. Sunil Joshi, tells me that since the program started in October, it's already saved taxpayers a lot of money and a lot of time for doctors working in the ER.
HealthLink Jax is a way for us to keep uninsured people out of the emergency room for relatively minor health-related issues, because a lot of people who don't have health insurance also don't have a primary care doctor. So they go to the emergency room as their source of primary care.
The free program connects people who don't have insurance to a doctor by providing them with a telehealth screening to determine their immediate needs.
It not only prevents them from having the costs associated with an emergency room visit, it prevents the hospital from having uncompensated care. So the hospitals are losing money by taking care of folks who can't afford to pay because they get no reimbursement out of that either. And in the big picture, it also saves taxpayers millions of dollars.
According to their numbers, from July of 2024 to July of 2025, HealthLink Jax answered more than 5,100 calls, more than 1,300 physician visits, and avoided more than $8 million in medical spending.
The taxpayers are spending $56 million a year that goes to University of Florida Shands here in Jacksonville for uncompensated indigent care. That is an unsustainable way to manage, tax dollars. And so we need to figure out a way to save money, keep people out of the emergency room.
Dr. Joshi says that he knows everyone has their own opinions about how the city's money should be spent. But in his opinion, these numbers prove his point.
So if we can, number one, have more people sign up for health insurance, number two, keep these folks healthy and out of the hospital, and figure out a way to divert the emergency room visits for them, how are we losing?
Now, at this time, people who qualify can still use the HealthLink Jax program by going to HealthLink 904-925-CARE or to the City of Jacksonville's website. The full City Council still has to approve the new millage rate. Now, that vote will happen in September, and the budget will take effect in October. Channing Curtis, First Coast News, on your side.